There is a moment, usually around 3 in the morning, when the human body does something most people never think about. Your blood pressure quietly rises. It happens right before you wake up, even if you're still asleep, even if the room is dark and silent and nothing around you has changed. Doctors call it the morning surge, and for millions of Americans over 60, that one silent moment is the difference between a normal Tuesday and a trip to the emergency room. If you are taking blood pressure medicine and you've simply been swallowing that pill whenever you remember, whenever it's convenient, whenever your coffee reminds you, then what you're about to hear in the next few minutes could change how you protect your heart for the rest of your life. Because here's the truth nobody tells you at the pharmacy counter. The time you take your blood pressure medicine can matter almost as much as the medicine itself. And most seniors, through no fault of their own, are doing it at exactly the wrong time. Stay with me, because by the end of this video, you're going to understand 7 things about blood pressure medicine timing that your own doctor may not have had time to explain to you. Things that could protect you from strokes, protect your kidneys, protect your memory, and maybe even add years to your life. Let's start with the story of a woman named Carol, because her story is the story of so many people watching this right now. Carol was 67 years old, living outside of Sacramento, retired after 30 years as a school librarian. She took her blood pressure pill every single morning with her coffee, right after she fed her cat. She never missed a dose. She thought she was doing everything right, and by every measure, she was a model patient. Until one ordinary Thursday morning, she woke up and the left side of her face wouldn't move the way it was supposed to. Her daughter rushed her to the hospital. It was a stroke. A small one, thank God, but a stroke, nonetheless. And here is the part that shocked her doctors. Her blood pressure readings during the daytime, when she took her pill, looked perfectly fine. But her nighttime numbers, the ones nobody was checking, were dangerously high. She had a condition called nocturnal hypertension, and like so many people her age, she never knew it existed because nobody had ever told her to ask. This is the first thing every senior needs to understand. Blood pressure does not stay the same throughout the day. It rises and falls in a pattern, almost like tides in the ocean. In a healthy pattern, blood pressure should actually dip down by about 10 to 20% while you sleep. Your heart gets a rest. Your blood vessels get a break. But for a large number of adults over 60, especially those with diabetes, kidney issues, or long-standing hypertension, that nighttime dip doesn't happen. Some people's blood pressure barely drops at all. And in some of the most concerning cases, it actually goes up while they sleep, which is exactly what happened to Carol. This pattern has a name. Doctors call these people non-dippers. And non-dippers have a significantly higher risk of stroke, heart attack, and kidney damage, often without a single symptom warning them in advance. So why does this matter for when you take your pill? Because researchers have spent the last 2 decades studying something called chronotherapy, which is simply a fancy way of saying that timing your medication to match your body's natural rhythms can make that medication work far more effectively. And one of the largest studies ever conducted on this topic, involving nearly 20,000 patients in Spain, found something that stunned the medical community. Patients who took their blood pressure medicine at bedtime, instead of first thing in the morning, had significantly fewer strokes, fewer heart attacks, and fewer deaths from cardiovascular causes over the years they were followed. Fewer, not the same, fewer, just from switching when they swallowed the same pill. Now I want to pause here and be completely honest with you, because trustworthy health information means telling you the whole picture, not just the exciting headline. Since that original study came out, other researchers have questioned the results and larger newer trials have shown more mixed findings. The truth today, and this is the second thing you need to know, is that the medical community does not have one single perfect answer that applies to every person. What works beautifully for your neighbor might not be the right approach for you. Your body, your specific medications, your kidney function, your other health conditions, all of these change the equation. This is not something to guess about on your own. This is something to bring directly to your doctor, and I'm going to give you the exact words to say to them a little later in this video, so keep watching. Here is the third thing that surprises most seniors. Not all blood pressure medicines behave the same way in your body, and that changes when they should ideally be taken. Some medications, like certain ACE inhibitors and ARBs, the ones with names ending in pril or sartan, have research suggesting they may work better taken in the evening for some patients, partly because that's when your kidneys are naturally producing more of the hormones these drugs are designed to block. Diuretics, often called water pills, are usually the opposite story. If you take a water pill at night, you already know what happens. You are up 3 times before sunrise, and not because of your bladder problems, but because the medicine is doing exactly what it's supposed to do at the worst possible hour. Most doctors will tell you to take diuretics in the morning for this very reason. And calcium channel blockers, another extremely common category for seniors, seem to have more flexible timing, but can sometimes cause more swelling in the ankles if taken at certain times of day. Do you see the pattern here? There is no single rule that fits every pill in your weekly organizer. This is exactly why guessing is risky, and why a 5-minute conversation with your pharmacist or doctor about your specific medications is one of the most valuable things you can do this month. Now let's talk about something deeply personal, something that connects to almost everyone watching this video. Falls. If you are over 60, you already know that a fall is not just an embarrassing tumble. A fall can mean a broken hip. A broken hip can mean months in rehab, loss of independence, and for too many seniors, it becomes the beginning of a much steeper decline. Here is the fourth thing you need to know. Blood pressure medicine can sometimes cause a sudden drop in pressure when you stand up too quickly, a condition called orthostatic hypotension. And this effect tends to be strongest in the hours right after you take your dose. This means if you take your pill and then immediately get up in the middle of the night to use the bathroom, you could be walking through a dark hallway during the exact window when your blood pressure is at its most unstable, and your risk of dizziness and falling is at its highest. Some doctors now recommend taking certain blood pressure medications earlier in the evening, rather than right before bed, specifically to reduce this middle-of-the-night danger zone. Others may adjust the specific drug entirely. Either way, if you've ever felt lightheaded getting out of bed at night, this is not something to brush off as just getting older. This is something your doctor needs to hear about directly, using those exact words, because it could be a sign that your medication timing or dosage needs adjusting. Let's talk about the fifth thing, and this one surprises almost everyone. Your blood pressure medicine and your other daily habits are constantly interacting with each other, whether you realize it or not. Grapefruit juice, for example, can dangerously intensify the effect of certain calcium channel blockers, something many seniors have never been warned about because it sounds too simple to be true. Taking your blood pressure pill at the exact same time as certain thyroid medications or calcium supplements can reduce how well your body absorbs either one. And here's one almost nobody talks about. If you take your blood pressure medicine with your morning coffee, the caffeine can temporarily spike your blood pressure right at the same moment your medication is trying to lower it, creating a kind of tug-of-war inside your own blood vessels. None of this means you need to give up your morning coffee forever. It simply means that consistency and awareness matter more than most people realize. The goal is not perfection. The goal is understanding your own personal patterns so that you and your doctor can work with your real-life, ideal schedule from a textbook. Now here is the sixth thing, and this might be the most important practical tip in this entire video. Doctor's office readings, the ones taken during your 15-minute appointment once every few months, only tell part of the story. Your blood pressure in that chair, with a nurse standing over you and a clock ticking toward your next appointment, is not the same as your blood pressure lying in your own bed at 2 a.m., or standing in your kitchen making dinner, or sitting in traffic worried about being late. This is called white coat syndrome, and it can make your numbers look artificially high or, in some cases, artificially normal, hiding real problems underneath. This is why more and more doctors are recommending home blood pressure monitoring, using a simple, inexpensive cuff you can buy at almost any pharmacy. Taking your blood pressure at the same time every morning and every evening for just 1 week, and writing down the numbers, gives your doctor something office visits simply cannot capture: a real picture of what's actually happening inside your body throughout your actual day. If you've never done this, consider it a gift you give yourself, one that costs less than a dinner out and could reveal patterns that change your entire treatment plan. And now, the seventh thing, the one that ties everything together. There is no universal magic hour that works for every senior in America. I wish I could tell you that taking your pill at exactly 8 p.m. guarantees protection, because that would make for a very satisfying video. But real medicine, honest medicine, doesn't work that way. What the research actually shows is this: consistency matters enormously. Taking your medication at roughly the same time every single day, whether that's morning or evening, helps keep your levels steady and helps your doctor actually understand how well the medication is working. Random timing, skipping days, taking it whenever you remember, creates a roller coaster inside your arteries that makes it much harder for anyone, including you, to know if your treatment plan is truly working. So what should you actually do after watching this video? Not guess, not change anything on your own tonight. Instead, I want you to do something simple but powerful. Call your doctor's office, or bring this exact list to your next appointment, and ask these questions directly. Ask, based on my specific blood pressure medications, is there research suggesting morning or evening dosing might work better for me? Ask, given my other health conditions and other medications, could my timing be creating a risk for nighttime blood pressure drops or falls? Ask, would home blood pressure monitoring help you get a clearer picture of my patterns throughout the day? These 3 questions take less than 2 minutes to ask, and the answers could genuinely be life-changing. Most doctors deeply appreciate patients who come in informed and engaged, rather than passive. You are not being difficult by asking. You are being exactly the kind of patient every good doctor wishes they had more of. I think about Carol often, the woman from the beginning of this video. After her stroke, her doctor put her on a 24-hour blood pressure monitor, one of those quiet devices that checks your pressure automatically every 20 minutes, day and night, for a full 24 hours. That's how they finally discovered her nighttime numbers were the real problem all along. Her medication was adjusted, part of it moved to the evening, and 18 months later, she's back to her mornings with her cat and her coffee, but now she also does a short walk every evening, because her cardiologist told her movement helps that nighttime dip happen naturally, the way her body was designed to do it in the first place. Carol didn't need a miracle. She needed information she'd never been given, and the courage to ask her doctor better questions. That's really what this comes down to. Your body has been taking care of you quietly for 60, 70, 80 years, adjusting your blood pressure while you slept, while you worried about your grandchildren, while you lived your entire life without ever having to think about it consciously. Now it's simply asking for a little bit of your attention in return. Not fear, not panic, just attention, and a willingness to ask one more question at your next appointment than you would have asked before watching this video. If this video helped you understand your own health a little better today, do me one favor before you go. Hit that subscribe button, because we release videos just like this one every single week, built specifically for people who want to stay strong, stay independent, and stay right here for many more birthdays with the people they love. And if you know someone, a spouse, a sibling, a friend from church, anyone who takes blood pressure medicine and has never once thought about when they take it, send them this video today. It might be the most caring thing you do for them all week. Thank you for spending this time with me, and I'll see you in the next one.